Asia Pacific is an area with rapid economic growth. However, along with the benefits that the development process brings about, there are still many shortcomings which countries in the region have not yet resolved. In the area of healthcare, especially in the reproductive healthcare, quantity services remained challenging in rural and remote areas. Viet Nam is also one of them. This is the first time that the largest regional conference on sexual and reproductive health has been held in Viet Nam. At the conference, participants will discuss the main theme, "No one is left behind, justice for sexual and reproductive rights." This is considered to be the large dialogue analysis of hot and emerging social issues related to reproductive and sexual health, especially among vulnerable population in rural and remote areas.
In Vietnam on VTC10 at Viet, we just witnessed the 9th Asia Pacific Conference on Sexual and Reproductive Health and Rights. And we're here today to find out more about this topic with the attendance of the representative of UNFPA in Vietnam, Ms. Astrid Bant. Thank you, Ms. Astrid Bant, so much for spending time with our program today. And we would like to know more about the event on the Asia Pacific Conference on Sexual and Reproductive Health and Human Rights.
Development in Asia and the Pacific is going well in general, but there's groups that are benefiting more and other groups that are benefiting less from development, and the same is happening in sexual and reproductive health and rights. So our motto is "No one left behind." We have never had a civil society-led event of this size in Vietnam. And I think it's also an historic moment because sexual reproductive health is becoming so important in Asia because of the fast-growing population and the enormous amount of young people we have, and also because there's been some changes in the world since the last time this conference happened. So I do think it's a very important milestone.
What are your impressions about the quality of sexual and reproductive health services in Vietnam compared to other countries in the region?
Vietnam is one of the countries that has reached the Millennium Development Goals in the area of sexual reproductive health, especially in maternal mortality, and we are very proud of that, and it shows that there is a large outreach to the population in that area of health. We also know that 90% of the population, more or less, uses family planning, so that's good. But we also know that there is a high percentage of failure, contraceptive failure, we call it, where people do use the method, but they don't use it properly, or the method that they use is not of good quality, and they get pregnant. We look at some quality issues still in Vietnam. We also see a lot of advances. New issues come up, like sexuality that is different from the mainstream. When we have lots of older people, that really comes with a package of other medical issues. As you know, we are working also on the introduction of HPV vaccine, which would be a really big improvement for women in Vietnam to be able to combat chance of getting cancers.
Do you see any challenges regarding the provision of sexual and reproductive health information and services?
Making sure that people have the best information so they can make their own choices, respect for the patient's rights. Those are things that can be improved, especially in faraway places. There are issues around distances, especially for emergency cases that have to do with providers. But these private providers are not always really good providers either, because there's not that much control.
Chương is over 30 years old. The main source of income for the family depends on one rice field and 2 cornfields. So after the second child, her family decided not to have a third one and wanted to put an IUD. However, 3 years ago, Minh Hóa Communal Health Station of Minh Hóa District, Quảng Bình Province couldn't provide this. The project, enhancing accountability in providing reproductive health and family planning services for disadvantaged people in 2 provinces of Lâm Đồng and Quảng Bình, has been piloted for such reason. The project is funded by Marie Stopes Việt Nam in collaboration with 2 provinces' health service offices under the auspices of the European Union, in which the people, customers of medical services, would have the right to score, comment, give feedback on the service quality and monitor the progress of change at the commune's health stations.
Tôi có thể trình bày được những ý kiến của mình.
Tôi đã đến trạm để khám phụ khoa, tôi đã thấy trạm y tế rất khác.
Nhân viên trạm y tế đã tạo cho người dân có những cái cảm giác thoải mái, thân thiện, tích cực trong quá trình đối thoại về những cái vướng mắc khó khăn của mình đối với trạm y tế.
Over 17,000 customers have access to quality reproductive health care and family planning services. Nearly 11,000 people have been educated to raise awareness on reproductive health, family planning, and consumer rights to health services. 21 training courses with 311 health workers participated. These are statistics after 2 years of implementation in Quảng Bình and Lâm Đồng.
Hiện nay thì hệ thống cung cấp các dịch vụ chăm sóc sức khỏe sinh sản kế hoạch gia đình đã được triển khai trên toàn quốc tại 63 tỉnh thành phố, và cái mạng lưới đã triển khai đến tuyến huyện và tuyến xã. Thì tất cả các dịch vụ đã được triển khai theo các cái hướng dẫn quốc gia của các hướng dẫn quốc gia về chăm sóc sức khỏe sinh sản do Bộ Y tế ban hành, và hiện nay hướng dẫn đã được bổ sung cập nhật. Và các dịch vụ, đặc biệt là những vùng nông thôn thì cũng đã được cải thiện rất là rõ rệt về chất lượng dịch vụ.
Vì là lại đặt riêng cái vấn đề về dân số với cả một cái bối cảnh rộng hơn là về sinh sản, cho nên là cái chăm sóc và cái tư vấn thì nó vẫn chưa được gọi là toàn diện. Ví dụ như là khi mà nói về vấn đề về biện pháp tránh thai chẳng hạn, thì chủ yếu là vẫn tiếp cận với các cặp vợ chồng. Còn lại là những cái nhóm đối tượng như là chưa kết hôn hay là vị thành niên chẳng hạn thì gần như là không tiếp cận được. Cái tỷ lệ mà vị thành niên ở Việt Nam mà không tiếp cận được biện pháp tránh thai ấy, thì cao gấp 2 lần so với cả những cái cặp vợ chồng. Đấy, để thấy là một cái rất là thiếu hụt.
Currently, with the provincial and central hospitals being overloaded, changing the provision of health services at communal health station is a very practical solution. Despite many remaining shortcomings in the facilities and quality of health services, people in rural and remote areas have somehow access to modern medical methods and gain awareness on reproductive health care and safe sex.
So, as you have mentioned, Vietnam is in the golden population, which means that the majority of the population is the youth. So, there is still issues regarding sex before marriage or early sex that impact negatively on the health of the youth. So, there is a need to raise awareness among the youth. So, what are the channels that we can do in order to raise the public awareness regarding this matter?
A big challenge would be the lack of systematic sexuality education in schools. We know there is some, but young people really need a comprehensive approach in this area. So this whole area, which is life skills, I think there could be a lot more done in that. And we know because most young people get their information from the internet and not from teachers and parents. So that shows that teachers and parents have some work to do to become better educators of their children in this area. So I would say there's some institutional challenges, like, get this more integrated into school formal education. And then there is an area which would be making sure that within the family, parents know how to accompany their children to become sexually active adults. But very often young women not very able to put their own boundaries and make sure that they are in charge of their own bodies. I think there is a lot of gender equality kind of dialogue that still has to happen. And not all of that happens in schools. It also happens especially in the media, but also in the family and in out of school and in the workplace. And it's a national dialogue with many different aspects.
There are also obstacles regarding the access to sexual and reproductive health services in remote area. What are your recommendations for Vietnamese government to tackle this issue?
What we're trying to help the government with in one way is to do the research, and that feedback loop, information that goes from the users back to the policymakers. It's an area that we're trying to strengthen so that we can permanently improve on the basis of how things are going. I think a lot of the policies are in place. It really has to do with making sure that in areas, rural provinces or rural districts where resources are limited, that and there's so many conflicting priorities. We make sure that sexual reproductive rights don't fall off the table.
Could you share with us on the programs of UNFPA joining hands with Vietnam in improving the quality of sexual and reproductive health services?
And one area that we have invested a lot in with the government, well, we call them traditional birth attendants or midwives, I think minority midwives. And a lot of these women who signed up for these courses, they invested a lot of their time, and they are now working in their where they came from, in their districts. But there's sometimes difficulty for their recognition and the way they're absorbed by the system. So these are low-cost, efficient fixes to get your outreach up in remote areas. But although the central government has seen the importance of it, they've been successful. Now it's a question of actually implementing it, and that's where we see the program. So we will be working on that.
Thank you so much, Ms. Astrid Bant, for all your sharing today. So that's the end of our program today. Thank you so much for watching us. For any questions and feedback, please email to sharingvietnam@net.tv.net. Thank you and see you again.